Okay, hello everyone, and welcome to PracticeHub's very first Facebook Live event. It's great to see you all here. Thanks very much for giving up your time to join us. So my name is Anna Maria Gibb, and I'm the Senior Product Manager at PracticeHub. I'm also one of the original developers of the product before it became PracticeHub and part of the Avant group. My background is in practice management and supporting practices through their accreditation process. And I also have a background in adult education as well. So I'm really excited to talk to you today about our social media policy. So as you may know, PracticeHub has a series of policy and procedure templates, and these Facebook Live events are an opportunity for us to talk to you about different policies and procedures. Even if you're not a PracticeHub user, we'll be talking about some guidelines around how to develop policies and procedures and key things that you should consider. So today we are covering the social media policy because having a robust social media policy is paramount for your practice and ensures that all the bases are covered, and being able to do that can be quite difficult. So what I'm going to discuss today is the definition of a policy and the definition of a procedure. Sometimes they get bundled together, and it's important to know that they have different purposes as well. We're going to talk about the requirements to implement the policy, what things are covered under a social media policy, why this policy is very important to your organisation, and other related resources, policies and procedures that can part of a sort of a family of resources and material that goes with the social media policy. So let's get started. Some general guidelines around policies and procedures. Three things I think need to be considered with policies and procedures. They need to be meaningful, so they need to actually apply to your organisation. They need to be easily understood. It's harder for people to comply if they don't clearly understand those policies. And finally, they need to be followed. It's all well and good to have beautiful documentation, great policies and procedures, but really important that your team is following them as well. So when we're thinking about developing a policy, we need to think about why is it required and the reason for its importance. So I think of a policy as the why. Why do we do what we do? And some of the reasons to consider when we're creating a policy is the reason why would be for compliance, and that would be compliance with legislation, regulations, standards, guidelines, and so on. Another reason to have policies would be around safety. So the safety of your patients, your team, and the general community as well. So these are another reason to have a good policy, why you've created it. Another reason is risk minimization. So you want to implement certain procedures in place to minimize the risk to your organization. And those risks could be clinical, health and safety risks, and also business risks as well. And probably the last main reason I think as to why we create policies is for operational excellence. So if we can document how we want things to be done in the best possible way, then we're kind of moving or achieving that operational excellence that we're all looking for, and that consistency as well in how processes are done. So now moving on to procedures. A procedure is really the how it all gets done. So who does it, when does it get done, how often, and what is the process as well. So it's very important to make sure that you think these things through. So who is responsible, the steps that are required, and again, documenting these things makes them ideal for training staff and also for ensuring that consistency in how things are done. The other thing that's really important, and we'll show this when we talk about the social media policy in a minute, is around thinking about other policies and procedures that impact on this particular one. So for example, when we talk about social media, we'll be thinking maybe about privacy and, in maintaining the privacy for your patients and so on. And lastly, Important to consider references and resources that you can link back to the policy itself. And these can be really useful from the point of view of case studies, so real life examples around the application of a policy, or what goes wrong when a policy isn't followed or there is no policy in existence. So those are the things that you need to consider when you're formulating policies and procedures. All right, so let's have a look at our social media policy. Now, if you already have a policy in your organisation, you'll probably want to have a think about, is everything covered in there as well? So in this instance, our social media policy talks about its guidance for employee use of social media, that social media has many forms, that there are many platforms. And although we list some of them, we also make sure we note that it's not restricted to just those platforms. This is a very rapidly changing environment. There are new platforms coming on all the time. And so this sort of factor of maybe you regularly review your policies to add those new platforms, but certainly highlight it's not just restricted to the ones that you've stated. Also in our policy, we talk about the fact that employees' actions can have an impact not only on their own individual image, but also on the practice's image and reputation. So that the information they publish could be in the public domain for a very long time. Employees need to use their best judgment about posting that material to ensure it's not inappropriate or harmful to the practice, to other employees, and to the patients. And we're asking that our employees observe these principles around integrity, professionalism, the all-important privacy as well. And the last sentence on here talks about the fact of what happens if people are not following this policy, and we're highlighting that there could be disciplinary actions. And again, when I talk about related policies, we'll talk about the discipline policy as well. So it's very clear to people that if they're not compliant with this policy, they can reflect on the discipline policy as to what may be the outcome. So having a look at our procedure, it's interesting that, you know, social media, it's not necessarily a who, how and when, but it is more around sort of directions and guidelines in this instance. So basically we're saying that they're prohibited, you know, they're prohibited from posting images that are defamatory, pornographic, proprietary, harassing or libelous, that they need to get permission before they refer or post images of current or former employees, contractors or patients. And this could be really relevant, particularly, for example, you have a staff member who says, oh, I really want to post an image of my colleague who's just got engaged, you know. Is that appropriate? How does the colleague feel about that? If you're in a town or a small regional area, everybody knows everybody. There's that added level of needing to be aware of privacy and that what you're sharing, how it impacts on other people in that community where everybody does know everybody. It's important that staff are clear that their online posts are personal and purely their own. And something to think about too, I think, with these is around if you've got people saying, but I didn't name the organisation and any of that, I didn't say where I worked. There's other ways that it can be obvious where somebody is working, either because they're perhaps wearing the organisation's uniform with the logo and name clearly visible, or just as I said before, they're in an area where people know everybody, their name is recognised, people know where they work. So there's these kind of indirect ways, even without stating the name, that people can, it can be obvious where somebody works. And we're similarly back up with the policy about these principles of integrity. We're also reminding people that they need to show respect for others and others' opinions in their posts. Now, it's a little bit of an ecosystem of all of this information. So some related policies and procedures I think are worth thinking about in here is around, say, things like the staff code of conduct. So you probably have a code of conduct that talks about these professionalism, integrity and those sorts of things, the importance of privacy. So that is kind of cross-referencing that that's important there. Secondly, the all-important privacy and confidentiality. So not abiding by the social media policy could not only cause reputational damage to the organisation, but also could find you in a position of having to report a privacy breach, which I suspect no one really wants to have to do. So again, it's really important to factor that into this social media policy. It's very likely that you have an internet and email usage policy that talks about the fact of things like not forwarding things that are not relevant, not sharing proprietary content. So there's probably some common ground between the internet and email usage policy and the social media policy. So it's a good way of reminding people that these are kind of all of this online presence has to be thought through properly. And as I mentioned at the beginning, the discipline policy. So if somebody is in breach of your social media policy or any policy, what is the discipline policy? How does the practice manage these things? Hand in hand with that is probably an investigation policy, so that there is things are done fairly, but it's clearly documented how these things are handled. Now, the other thing that I mentioned is some helpful resources. And one that I think is really valuable in this context is the RACGP's Guide for the Use of Social Media in General Practice. Excuse me. Now, if you're not in general practice, I would say don't be put off by the fact that it's come from the college and that it references general practice. I think this is a terrific guide for any healthcare organisation. It's just the RACGP has put this together and it is a terrific resource. And again, I think it ties together some practical tips and some background information to help support your policy that you have in your practice. So I quite like, there's some really good little bits of information. It talks about, it references things like the medical board and those sorts of things. So I think that's really valuable as well. All right. So let me see, I have some questions. Thank you very much to those of you who've sent us in some questions. So does the policy address advertising guidelines and how to deal with negative comments? This particular policy that we're profiling today doesn't. That would be a separate policy. So social media, there is this kind of two parts. One is the organisation and its public profile and, you know, dealing with negative comments, those sorts of things. And this is more about your team within the organisation and how they use their social media platforms and how it impacts on the practice itself or in the organisation itself. So that area around negative comments, advertising guidelines is very much a separate area that we would have a separate policy for that. Probably just as a comment, I would say, you know, there are good guidelines on the AHPRA website and the medical board site around advertising guidelines and the use of social media, and in particular the use of testimonials. And so I tend to think that there's good material out there that you can reference if that's topical for you at the moment. Regarding dealing with negative comments, I know on many of the practice manager forums, there's a lot of discussion around this. I'm probably not going to really address what you should do, but I would say go to trusted sources of information. So talk to your medical defence organisation if you're going through that, who can give you some good guidance on how to manage those things. So a question again from the audience, how do you add related policies and procedures? Well, in PracticeHub, it's really simple. I'm actually in a different user, so it's very simple to do that. It's a matter of basically opening up a link list and picking the link that you want, pressing save, and it automatically appears on the page. So that, I think, is an exercise that's really worthwhile. And even if you're not using PracticeHub, creating that sense of, you know, these things are all interconnected is really important. Okay, so this is a short, sharp, quick overview. So last things to highlight to you: remembering the difference between a policy and a procedure, making sure that you do think about what other policies and procedures apply, looking for good references and resources from trusted sources is really useful. Most importantly, or equally importantly, is discussion and training. These things are great to be having all this documented, but it's really important that you discuss the context of these policies and procedures with your team, ensure that people actually understand them. As adult learners, we often learn differently, so that ability to discuss it, some people just reading the policy may not get the best understanding. So having that ability to do some discussion and training, some what-if scenarios that everybody's aware of. If you ensure understanding, you're increasing compliance, you're minimizing risk. And in terms of being able to make that an area of risk that you minimize is really important, because social media is such a huge part of our lives now. So again, just reminding you, your policy and procedure, meaningful, understood and followed. Thanks very much. Hope you can join us for our next session of Facebook Live.